Hi there, and welcome to Mercy Care's overview of services for individuals with a serious mental illness determination, or SMI. In this video, we will go over some of the services and supports that benefit our members and their family members. At Mercy Care, we have an Office of Individual and Family Affairs. Sometimes you will hear this office referred to as OIFA. What is OIFA? OIFA is a department that is made up of employees with lived experience as either a member, family member, or a combination of both. The mission of OIFA is to make sure that member and family member voice is present in our system and it affects change for system improvement. Our goal is to foster a culture of respect through offering support. Our goals are to help individuals and families engage with their health plan, access resources, and understand what services and supports are available to themselves and their loved ones. By helping individuals and families navigate the system, we build a community of individuals that are better equipped to advocate for their loved ones and share their story and experiences with others. Just like the OIFA department, there are also individuals that work in our system and community that have lived experience of receiving services who now work as a peer support specialist sharing their experience. Peer support specialists assist in the recovery journey for members. Oftentimes, we are given advice from individuals that haven't experienced what we are going through. By having someone who had a similar experience in their own lives, sharing what worked for them, and offering hope in difficult times, it's a lot more meaningful, and it also comes from the right place. Similar to peer support services, there are also family support services available to family members of individuals who receive services. Family support is really important because oftentimes family members do not know what to do when they find out a loved one is struggling with a mental illness. Family support helps families to understand mental illness, learn what to do in a crisis, and help their family members to understand how mental illness can affect their relationship with their loved one. Peer and family support originate from the disability rights movement of the 1960s. In the past, many individuals with mental health challenges were institutionalized. And when the institutions began to shut down due to poor conditions, the individuals that were in the community did not have a lot of support outside of their family and friends. Through banding together and forming their own groups, they learned that lived experience can contribute to the system in a positive way and help to improve outcomes. These individuals fought to have a seat at the table and started the movement of nothing about us without us. This meant that moving forward, there needed to be an opportunity for individuals who receive services and their families to have a say in the decisions that would be made regarding services. Additionally, we began to see peer and family organizations start to form, which are organizations that are run by individuals with lived experience that provide services to members and family members. In our network, we have several peer and family-run organizations. These organizations have shown through research and data to be more effective in helping an individual to achieve recovery and develop a sense of belonging within their community. They are also recognized by the Substance Abuse and Mental Health Services Administration as an evidence-based practice. You can connect with peer and family support services by working with the Peer and Family Referral Center, or the PFRC. This agency helps to connect you and your family to services that are individualized and focus on your goals for recovery and community connection. The PFRC assists with the referral process and is staffed by individuals with lived experience. You can connect with the PFRC by emailing support@referralhelp.org or by calling 602-842-3308. In addition to services, there are opportunities to connect with the community to raise awareness about mental health and to fight stigma. One way is by joining a committee. Committees at Mercy Care help us to make decisions and discuss system challenges. We have several committees at Mercy Care with members and family members. Some of the committees are the Governance Committee, the Youth Leadership Council, the Member Advocacy Committee, the All Text Member Councils in Phoenix and Tucson, the Cultural Competency Committee, and the Foster and Adoptive Kinship Care Committee. You can sign up for a committee by visiting mercycareaz.org/involved/committees to apply. You can also participate in an advisory council at your health home. Advisory councils are opportunities for members and families to speak with health home staff to address any concerns and improve member and family satisfaction, as well as improve quality outcomes at the health homes. These meetings are held monthly, and you can find out more about the specific times and dates of the meetings by reaching out to your clinical team at your health home. Another way to stay connected is through joining the Access OIFA mailing list. Each Friday, a newsletter comes out with information on events in the community, job openings for peer and family support, policies that are open for public comment, and additional information that is pertinent to the community, as well as members and families. You can join this newsletter by texting OIFA list to 22828. You could also subscribe at bit.ly/OIFA news, or you can capture a picture of the QR code on the screen by bringing up the camera on your cell phone and scrolling over the picture. A link should appear to sign up for the mailing list. You're able to unsubscribe from the mailing list at any time. Another way to stay connected is through our community-based partners, one of which being NAMI Valley of the Sun. NAMI stands for the National Alliance on Mental Illness, and it's the nation's largest grassroots mental health organization. Your local chapter is NAMI Valley of the Sun, and all of their programming is completely free, and there are groups that are led by family members and peers. In addition, NAMI advocates for policies that support recovery and person-centered care. You can connect with NAMI through visiting their website, namivalleyofthesun.org. Mercy Care also has an ombudsman within our OIFA team. An ombudsman is a neutral advocate that works with a member to provide system navigation and education, answer questions about services, help make connections for services, explain what options are available, and lets you know your rights. An ombudsman investigates member concerns and assists in finding resolution. Anyone can reach out to the ombudsman with a concern. We do request that individuals reach out to their provider as their first point of contact when concerns arise, but if you feel like you need additional support, the ombudsman is available to help. Even if the ombudsman is not the person you need to talk to, she will connect you with the right person. If you need to work with the ombudsman, you can reach out to her via oifateam@mercycareaz.org. In addition, Mercy Care has some other resources for members and families. If you have any questions or are unsure of your coverage, you can contact Mercy Care Member Services at 602-586-1841 or toll free at 1-800-564-5465. This line is available 24 hours a day, 7 days a week. You can also visit our website at mercycareaz.org. And if you need to connect with the OIFA team or our ombudsman, you can reach out to OIFA at oifateam@mercycareaz.org. Thank you.